Hi, I'm Dr. Charlene Koch, and today I'd like to talk to you about inflammation. You may have noticed in the popular press more and more over the past 10 years information about inflammation being potentially a key factor in our health. Also, it's a robust area of research right now, and a lot of information coming out right now is showing it's either potentially an initiator or a promoter of different diseases. I also find clinically in my practice, if I don't address inflammation, that the patient's condition doesn't turn around that quickly or is resistant to treatment, or it's very difficult to regain health again. You may experience the inflammatory response when you get a cut. So when you get a cut, you'll notice that it's either hot, it looks red, it's swollen, you may experience pain. And that's the immune system's reaction to an invader to fight off the infection. And so what it does is it releases inflammatory molecules called cytokines that promote other immune cells to the area to help fight off and repair the area. And that's a really healthy response. Another healthy response is just when we get a cut, we want to be able to create clotting factors so that we don't bleed to death. So it's really important. Inflammation is really important in the body, but it's when it becomes out of control or imbalanced where we have this chronic pro-inflammatory state. We may see conditions set up such as when the immune system attacks itself. We might think of autoimmune conditions such as lupus or rheumatoid arthritis or MS are really common ones. We also see with this sort of pro-inflammatory state, we see it either as an initiator or promoter or a factor in disease processes such as neurodegenerative diseases like Alzheimer's or Parkinson's disease. We see it with various different skin conditions, with different digestive disorders. Also, just some symptoms that I find when there's an inflammatory burden on the body, we start noticing that that patients have like chronic allergies, or they have stomach upsets, they have a lot of rashes or joint pains or unexplained headaches. So those are some of the key symptoms that patients notice, or just mood disorders, fatigue or anxiety or chronic depression. And I find some of the ways that we can intervene, or maybe one of the most powerful ways to intervene, is an anti-inflammatory diet. So a lot of like fresh vegetables and low glycemic fruits, which I think of like the dark berries, and then eating more omega-3 fatty acid type foods that you get from like sardines or salmon, and avoiding a lot of the foods that a more pro-inflammatory, the more omega-6 pathways. So avoiding a lot of packaged foods, hydrogenated foods, sugars, simple carbohydrates. So that's one of the really key factors. Also, other lifestyle factors that we know really impact inflammation burden on the body is stress. So if we don't have proper social support, or if we've had a lot of abuse, or we're just under a lot of stress because we're being a caretaker, that is really an important area to address. Also, some other areas are of lifestyle, or is if somebody, if especially in women in studies, if they're overweight or obese, we do see in blood work when we test inflammatory markers, if they lose just 5% of their body weight, we do see those inflammatory markers reduce. We also see the inflammatory markers reduce in the blood work if people exercise even 2.5 hours a week, doing moderate or vigorous exercise. And also, I keep bringing up the digestive tract and the types of food we eat because it's so key. We do know that the digestive tract is really impacted by stress and by food, and that it lots of times is the initiator or promoter, or will eventually get involved in the inflammatory response. So anything that we can do to keep our intestinal tract healthy is key. And so that would be avoiding antibiotics. So we don't want to change our microbiome of our digestive tract. So really, we might need to supplement it with key probiotics. with nutrients to keep the lining of the digestive tract intact, and digestive enzymes to make sure that we're breaking up our food so that we get all the nutrients, vitamins and minerals that we need to stay healthy. We do find if there is an imbalance in the bacteria in the digestive tract, that they can start promoting a pro-inflammatory state, which will compromise the digestive lining. And when the digestive lining is compromised, we start seeing the immune system being introduced to proteins and viruses and bacteria, setting up again this inflammatory response. Also, is a really burden on the liver. The liver has to deal with a lot of the toxins that the body itself produces in its own cellular redox reactions, and also the toxicants that we're exposed to through the environment, like pesticides, herbicides, heavy metals, and then also just the byproducts, the toxic byproducts from the bacteria themselves, the inflammatory molecules. So if that system gets compromised, one of the conditions start seeing, and it's one of the burgeoning areas in medicine that is the most concerning going forward, is non-alcoholic fatty liver disease. And that is such a critical area right now, because it leads to a lot of people potentially having to get liver transplants down the line. And basically the liver is having a difficult time dealing with all this inflammation and toxins, and starting to lay down fat. And the fat starts recruiting the immune system, which starts setting up this inflammatory response, inflammation leading where the body starts laying down scar tissue in the liver, and then potentially cirrhosis, which then leads to liver transplants. So anything that we can do to reduce the inflammation in the body and that burden on the body is so key. I find that if I don't address those lifestyle factors and those key factors, and also sort of root out any chronic infections going on in the body from viruses or bacteria, if I don't address that, then we'll have to start using anti-inflammatories at a higher level than is necessary, because the redox cellular inflammatory pathways are not being supported through key antioxidants or nutrients. And also I find that, a lot of patients have been put on prescription anti-inflammatories or steroids, which really creates an imbalance in the immune anti-inflammatory and metabolic processes, inflammation pathways, and so that potentially can lead to problems. So one of the common side effects of steroids that you see is that if a person is on it for long periods of time or at high dosages, they can't fight off infections, and they start having a lot of like mood disorders and other side effects, undesirable side effects. So I like to use natural anti-inflammatories that work on all the different metabolic processes of inflammation, and also have a really good anti-inflammatories or antioxidants in it that works on these redox cellular inflammation pathways. And so I'm really excited that we came out with our Move Free Inflama-Ease product, because it has all of the anti-inflammatories that help tone the anti-inflammatory system, and then also it has the antioxidants that work on the redox, the cellular inflammatory to modulate that inflammation. And so it has in it curcumin, boswellia, rosemary, and also rutin, quercetin, resveratrol, and proteolytic enzymes that are really key in working on the inflammation and the key antioxidants. So I hope you found this video helpful, and why addressing inflammation is so important, and a key for our health. Thank you for watching.